should you do after having unprotected sex? Whether it was a heat of the moment decision or something unexpected, unprotected sex happens. But now, what next? In this video, I will give you steps that you can take immediately after having unprotected sex to protect yourself, prevent unwanted pregnancies, and reduce the risk of STIs. The first thing you should do after having unprotected sex is to take a moment to check for any visible signs of sexually transmitted infections on the other person or your partner. Look for anything unusual such as genital warts, sores, redness, or blisters that might indicate conditions like herpes or HPV. Now, if you notice that this person has, say, genital warts, they usually look like this. This mostly indicates that they have the HPV virus. So you have been exposed to the virus, and you should go and see your doctor and explain what has happened. At this stage, even if the doctor does a HPV test on you or a herpes test, the results will be negative because, of course, it takes some time, a few days for the virus to be detectable in blood and for signs to appear. But I am not saying that if you look at the person and they are clean, no warts, no sores, they cannot have these diseases. Most people actually have these diseases, and even they themselves don't know because they have no symptoms. Another thing you need to take is tests. Take a HIV test. Maybe you met and went right into the action. Now that the action is done, please take a HIV test. And do not, I repeat, do not use your eyes to test someone. This one cannot have HIV. My friend. Now, if both of you are negative, that is a good thing. You are not 100% safe because that person could have been exposed to the virus the other day and it is not yet detectable in blood. But if you take the test and find out that the person is positive, please visit a clinic, explain the situation, and get post-exposure prophylaxis drug, what we call PEP. Or if the person refuses to take the test, or you are feeling in your spirit that, sometimes women feel things in their spirit, then go and get PEP. You are supposed to take them for 28 days in order for them to be effective. Another test is a pregnancy test. If you have sex today and take a pregnancy test tomorrow, of course, it will be negative. You have to wait for 14 days after the action to take a pregnancy test, because that is when the pregnancy hormone will be detectable in blood or urine. And I have talked more about the signs to know if you are pregnant in this video right here. So if you know your cycle and you are safe, then you don't need to worry. But if you are in your fertile window, then you should take the morning after emergency pill like P2, EC2, and there are many others. Okay, you should take the emergency pill within 72 hours after the action. That is within 5 days. But I do not recommend waiting for that long. The earlier the better. Normally, you should take it the morning after the action. That is why it is called morning after. You get it? But what if the action is done in the morning? Still take it after the action. Ladies, please, an emergency pill is not an abortion drug. It prevents you from getting pregnant. So if you are already pregnant, even if you take 20, it will not remove the baby. I have seen ladies try this, and please, it is not an abortion drug. Another thing, you can get an IUD inserted within 5 days after the action to prevent you from getting pregnant. Now, if you did not give the other person consent and it is an incident of rape, do not shower and do not remove your clothes. You can call a close friend and relative, explain what happened, and ask them to take you to the nearest police station to report the incident. I'm saying this because it is not a good idea to be alone after going through this. Different countries have numbers which you can call to report the accident. But if you use protection and you suspect that the condoms might have teared or broken, check them after sex. If you notice that it was compromised, then you can do the steps that we have talked about. Take an HIV test and also take an emergency pill. Another thing you should do is urinate immediately after sex. Sex is a major cause of UTIs. Now, forget all those stories about public toilets and wiping from back to front, front to back. During sex, there is a lot of motion, back and forth. So it is very easy for bacteria that are in the genitals or in the anus to be brought to the urethra. And the urethra, especially in women, is very short. So the bacteria travels a very short distance, causing a UTI. So urinating immediately flushes out these bacteria before they can travel up the urethra and cause a UTI. You should also drink a lot of water. Drinking a lot of water helps you urinate more and helps and hence cleans up the vaginal area, preventing UTIs. Now, go and take a shower. Some people just want to go and sleep like nothing happened. Now, you cannot do that. You will, start getting some funny odors down there. The vagina has an acidic pH. Now, when you have sex, the sperm changes this pH to be more of basic. So, this change in pH can cause some funny smell and also increase your risk of getting yeast infections. So after the action, it is good to shower and wash off any bacteria and and any semen that may be spilled on you. Ladies, I'm not telling you to start washing the vagina, trying to remove any semen and sperms that are in there. Please do not douche. Don't insert fingers inside the vagina trying to clean it. No, just take mild soap that you normally use and wash your vulva. I have made a detailed video teaching you how to wash your vagina and your vulva, so make sure you check it out. Wait, we are not done. Before you get out of that bathroom, brush your teeth. You did some things with the mouth, so just brush your teeth. Okay, now if there were other participants in the action like machineries and gears, you need to wash them. Clean them to reduce the risk of transmitting infections and to clean out any bacteria that may be on the surfaces. You can use disinfectants such as povidone to make sure all the surfaces are bacteria free and ready for next time. I'm talking about toys, by the way, if maybe you got lost on machineries. If after a few days you begin to notice some discomfort, itching, irritation, a fishy odor, a smelly discharge, go and see your doctor. By the way, do not be afraid to seek help. Visit a clinic and explain these signs and let them treat you. And if you want to know what happens to your vagina or your penis if you stay for long without having sex, then you should watch this video and this video. But don't click on them just yet. Make sure to subscribe if you want to keep learning more with Dr. Raisha. Okay? See you over there and there.